Could you introduce yourself?
Yeah, so I'm Dr. Jayesh Bhanushali. I am a resident of Thane. I finished my MBBS and MS orthopedics from DY Patil, Navi Mumbai. And after that, I worked 1.5 or 2 years as a general orthopedic surgeon in Thane. I was working at Jupiter Hospital back then, and I always had an interest to learn spine and had developed this passion for spine surgery during my residency. My professor Dr. Ashit Rao and Dr. Ravindra Khedekar, I used to do a lot of spine surgeries with them. That's how I developed it. And I was looking for a spine surgery fellowship ever since. I used to keep on visiting many spine surgeons in Mumbai for applying for fellowship. Every weekend I used to go on fellowship hunting literally. And that's when one of the senior colleagues, I would say Dr. Milind Patwardhan, he mentioned me that Dr. Bhojraj had a rural spine fellowship. There was no uh, regular fellowship which was up for grabs. So I thought about it. I understood what the project was about, and then I said, let's give it a try. And then Dr. Bhojraj asked me that you would practice in Thane or Mumbai or wherever. How would a rural fellowship benefit you? So I'll be very honest here. So my basic idea was to learn spine from Dr. Bhojraj. And then I thought, while doing this, if I'm getting an opportunity to do a charitable, noble work, then why not? And that's how I got here.
Okay. And now, what role do you play in the Spine Foundation?
So when the camp started, initially my role was exactly what Mahesh is doing right now,
Oh,
alongside whatever other spine related activities that happened. So right from organizing the camps, this was of course with the guidance of Dr. Premik. So right from doing all the bookings, organizing camps, making sure everything is done, checking, going through the checklist, all those things. And right now, after my fellowship, there were new fellows who had joined. Dr. Harshit is the present rural fellow. So I try to chip in wherever there is a need of hands in whichever camps possible, and that's how things are working out right now.
how does the Spine Foundation function in rural and tribal areas?
The inception of Spine Foundation actually started from Gadchiroli back some 15 17 years back when Dr. Bhojraj started coming here. He developed a format of making camps happen. So initially we do OPD screening camps where we train the locals how to screen patients who would get better just with physio and lifestyle changes and who would actually need surgery. Then after doing multiple OPD camps, we used to shortlist a couple of number of patients and then they would come up for surgery. Now before all this could happen, what we would do is see how feasible it is to go there and operate there, and once everything is in place, then surgery camps would also happen. Now once people around, they have a very uh, you may say a fear in their mind that once you get operated for your spine, you may be bedridden forever, won't be ever able to walk. So once they see the results, they sort of get that confidence, and then one successful camps lead to more successful camps. So that's how it works here. And although we say that the village people are more active, how can they get these spine problems? It is mainly a problem of people who are sitting all the time, but they have their own different set of problems. So every village will have a different problem. Like we go to Rishikesh, those villages have mostly spinal fractures because they work in hilly areas. They tend to fall down, they tend to lift heavy weights on their head. So every village has their own, every cohort has a different problem, but problem is always there. And once we had a model here, we tried to replicate the same model everywhere, all over the RSSC areas.
What things motivated you to work for the tribals and the people who are underserved?
So when I joined Spine Foundation,
Yeah.
my second day was a camp,
Oh.
and I had gone to Ambejogai. I was just taken aback at the way things were flowing. And the next month's camp was this Gadchiroli camp. And luckily that time there was this program going on called as Nirman. Nirman is a program of search wherein they sensitize young generation, kids or young adults who are in their late teens or early 20s towards this social problem where the underserved people are not getting enough attention, or there are no facilities available to address their problems. And that's a very interesting program. And while helping Dr. Bhojraj, I also attended the sensitization program, and it really enlightened a sense of empathy for the underserved population, and that's how I got more interested into serving the tribals and the rural population.
Was working in rural areas
Hmm.
affected and changed your life as a person?
So, working in rural areas, I have developed a sense of empathy towards the patients, where empathy is something where you feel the same kind of pain what the patient is going through, and then it helps you treat the patient better. It is like you won't be able to differentiate what a poor or a rich patient would be. So that's how it has helped me develop my own practice and connect with my patients and understand their problems and treat them accordingly as per their problems. So that's how rural practice has helped me. And one more thing is, now that we have developed the center here, most of the things are available. But initially when we started this, it was a very reserved setup. We didn't have a lot of gadgets, a lot of equipment. So we developed a ability to make yourself work and make do with everything with whatever is available, and that also has helped me in my urban practice, because then everything starts suddenly feeling like a luxury. तो कभी कुछ नहीं available होता, we are still able to manage everything because we are trained to do in the least of the setups.
What are your future plans as a Spine Foundation member?
So right now I don't have a exact plan of action, but I'm just going to keep helping sir as much as I can, and eventually as we move forwards, definitely there will be new members adding on. So firstly teaching them how to continue doing sir's teaching, and doing something of my own also. I already have taken up responsibility of one center, and Gadchiroli is like a home ground for all of us, where the whole idea of rural camps had started. So I'll keep doing my bit every now and then. It's a wholesome experience that we get from our day to day practice or day to day lifestyle. So of course this will go on, the legacy has to continue. So teaching more and more fellows or training more people and taking up new centers. Once a center is self-sustained, then switch over to a new center where there is a need of rural spine empowerment or camps where it is needed.
Lastly, what message would you like to give to our audience?
So considering the target audience to be medical as well as general fraternity, I would encourage everyone to support the cause, and medical students or personals to take up something like this. Trust me, it is a very wholesome and enriching experience. That's about it. Thank you very much for having me in this interview.